Noonan syndrome is a genetic disorder. It affects many parts of the body. It is present at birth, but sometimes not diagnosed until later in childhood. People with Noonan syndrome have distinctive facial features. They may also have heart defects, short stature, and other health problems. Noonan syndrome is relatively common, affecting approximately 1 in 1,000 to 2,500 people. This syndrome is not caused by anything the parents did or did not do. It is a random occurrence during the formation of the egg or sperm. It is important to understand that individuals with Noonan syndrome can lead fulfilling lives. Early diagnosis and intervention can significantly improve outcomes and quality of life. Noonan syndrome is caused by mutations or changes in certain genes. These genes normally provide instructions for making proteins that control growth and development. When these genes are mutated, the proteins are not made correctly. This disrupts the normal growth process and leads to the characteristics of Noonan syndrome. There are several genes associated with Noonan syndrome. The most common gene is called PTPN11. Mutations in this gene account for about 50% of all cases. Other genes involved include SOS1, RAF1, and RIT1. Genetic testing can identify the specific gene mutation a person with Noonan syndrome has. Noonan syndrome affects physical development. These features can vary considerably from person to person. Some common characteristics include widely spaced eyes, drooping eyelids, low-set ears, a short neck, and a webbed neck. Individuals may have a broad or prominent forehead, a short nose with a wide base, and a deep groove between the nose and mouth. Other noticeable signs can include chest deformities, such as a sunken chest bone or pectus excavatum, and a protruding chest bone or pectus carinatum. Short stature is also common, although some individuals may be of average height. Infants with Noonan syndrome may have feeding difficulties and slow growth. Along with physical characteristics, Noonan syndrome can cause health problems. Heart defects are common. The most frequent heart defect is pulmonary valve stenosis, a narrowing of the valve that controls blood flow from the heart to the lungs. Other heart problems can include hypertrophic cardiomyopathy, which is the thickening of the heart muscle, atrial septal defects, a hole in the wall between the heart's upper chambers, and other valve abnormalities. Other health issues can include developmental delays, learning disabilities, and behavioral problems. Vision and hearing problems are also possible. Some individuals may experience bleeding disorders. Regular medical checkups are crucial for managing these health challenges. To understand the impact of Noonan syndrome, it's helpful to consider real-life experiences. Imagine a child, let's call him Ethan, who was born with Noonan syndrome. Ethan has distinctive facial features. He also has a heart defect that required surgery when he was a baby. Ethan's parents were initially devastated by his diagnosis. They worried about his future and the challenges he might face. Despite these early difficulties, Ethan is a happy and active child. He attends mainstream school with support and enjoys playing with his friends. Ethan's story reminds us that while Noonan syndrome presents challenges, it does not define a person's life. With early intervention, support, and a positive attitude, individuals with Noonan syndrome can thrive. Living with Noonan syndrome can be challenging for both individuals and their families. There are frequent medical appointments, potential surgeries, and ongoing management of health issues. There may be educational and social challenges. Individuals with Noonan syndrome may experience frustration, anxiety, and social isolation. It is essential to have a strong support system in place. This can include family, friends, healthcare professionals, and support organizations. Connecting with other families affected by Noonan syndrome can provide a sense of community and shared understanding. Early diagnosis of Noonan syndrome is crucial. When the syndrome is recognized early, interventions can be put in place to address health problems and support development. Early intervention services, such as physical therapy, occupational therapy, speech therapy, and educational support, can make a significant difference in a child's life. Early diagnosis also allows for genetic counseling. This helps families understand the inheritance pattern of Noonan syndrome and make informed decisions about family planning. While there is no cure for Noonan syndrome, early and ongoing management can greatly improve outcomes and quality of life. There are many resources available for individuals with Noonan syndrome and their families. The Noonan Syndrome Foundation provides information, support, and advocacy. They offer educational materials, connect families with medical professionals, and fund research. Other organizations, such as the National Organization for Rare Disorders and the Genetic and Rare Diseases Information Center, provide valuable resources and support. Support groups, both online and in person, can connect individuals and families with others who understand their experiences. These groups provide a platform for sharing information, coping strategies, and emotional support. Additionally, the Noonan Syndrome Association, NSA in the UK, offers support and resources for families. Remember, you are not alone in facing the challenges of Noonan syndrome. While Noonan syndrome is a lifelong condition, there is hope for the future. Researchers are working to better understand the syndrome and develop new treatments. Advancements in genetic testing are improving diagnosis and personalized treatment approaches. Clinical trials are underway to investigate new therapies for heart defects and other health problems associated with Noonan syndrome. With continued research and support, individuals with Noonan syndrome can look forward to brighter futures. The dedication of researchers, healthcare professionals, and families is paving the way for new discoveries and improved care. The journey may have its challenges, but with knowledge, support, and hope, individuals with Noonan syndrome can lead fulfilling and meaningful lives.